Knock knock.
Yes.
Can I come in?
Yes, you can come
Uh, Hi, my name is Geneviève. I'll be a nurse today, and I'm gonna be performing uh, the assessment, the HEENT assessment on you. Okay, which I'm gonna assess your head, goes down to your eyes, your ears, your nose, your throat, your neck. Okay, is that okay for you?
in. Yes, it's okay.
Okay. First of all, I'm going to provide some privacy, okay? Cotton. And then I will wash my hands. Since my hands are not visible, so I use the alcohol base. So I will rub my hands until they dry. Okay. So can you tell me your name
Leslie.
and your date of birth?
11/24/99.
How do you want me to call you?
Leslie.
Okay, Leslie. So I will start with my assessment, okay? First of all, I will ask you some questions. Do you have any pain,
No, no pain.
any allergies?
No, no allergies.
Okay. Can you tell me what brought you today?
Physical checkup
Okay. Do you know where you are?
in Gaithersburg, Maryland.
Uh, do you know today's, can you tell me today's date?
September. Today's Friday, September 2020.
And what is the president, who is the president of the United States at this time?
And Donald Trump.
Okay. The patient is alert and oriented time 4. Are you exercising?
Yes.
Do you smoke?
No, I don't smoke.
Are you on any medication?
No, no medication.
Are you safe at home?
Yes, I'm safe.
Okay. So are you married?
No.
Children?
One.
Okay, good. Now I will start my assessment, okay? First of all, I will. Do you have any like concern about the head?
No.
Any injuries?
No injuries.
Okay, so I'm gonna first inspect your hair, look for the hair color, or look for the symmetric. Okay, so I can see your hair is well distributed and your hair is symmetric. There's no involuntary movement. Your hair is shaped like well. So then I will go inside to palpate, okay? When I'm palpating, I'm going to look for any like scars, any bump, any holes. I didn't see any hole. And I'm gonna go and check your occipital bone, which is fine. Everything is intact. Then I'll go to the facial, okay? For the facial, I'll look the hair on the skin. Your skin is a good color. And then I will check for the eyelash, as expecting for the eyelashes, eyebrow, any symmetric. Your hair is symmetric. And then I'm going to check, I'm going to be touching, palpating for the temporal pulse, the tempo arterial, the temporomandibular jaw, which is fine. Can you open your mouth for me? They are closed, are from their cheek. Okay, good. And then I will check for a sinus, okay? First of all, I will check the top. Can you tell me if you are in pain?
No, no pain.
Any pressure?
No,
How about here? Pain?
no,
Any pressure?
no pressure.
Okay, so everything looks good. And then I'll go down to your eyes, okay? I'll inspect to see, look at your eyelashes, your eyebrow, if they are well distributed, and both eyes are symmetric, and I didn't see anything wrong. Then I'm gonna go inside with my pen light, not inside, but I'm gonna use my pen light to check the inside. And you see, before my pen light even, I'm gonna check for the sclera, okay? So the sclera is white. There is no redness. There is no yellow color, because red could indicate infection, and the yellow color will be a jaundice. Okay, so with my pen light now, I'm going to check for the pupils. So do you have any problem with your eyes?
Mm-mm.
Did you check your eyes every time
Yeah.
to the doctor office? Okay, so I will check for the pupils. What I'm going to check is to look at your pupils, how they react to the light. Okay, so I'll go like this. When I look at the left side, the right side should constrict. And when I look at the right side, the left side should constrict. So this is, I'm checking the canal 7, 8, and 9. So your pupils are equal, round, react to the light, and accommodation. And then now I'm going to check for your the movement of your pupils. Okay, so I want you to follow the light. Okay, good. Yeah, good. This is a cranial nerve. So then I'm gonna go, I will check now for the constriction. The movement is the cranial nerve 3 and 6. Now I'm going to check for the constriction. Okay, so as I'm going closer, the eyes should constrict, the pupils should constrict, and further the pupils will go back to the normal. Close, constrict, further go back to the normal. So your pupils are constricted. The normal, they are in a normal size, because from 0 to 4 is normal. More than 4 is like dilated, and that means we have to do further exam. So right now your pupils are good. Okay, they don't have any problem. They are constricted very well. So then I'm done with your eyes. I will go to the ears. For the ears, I will inspect. Do you have any hearing problem?
No.
Okay, so I will inspect. The ears are symmetric. I can see like any external scale, no redness. The color is good and the shape is good. Now I will go in the structure to look if there's any abnormal discharge, any redness, any bleeding. No. I will go to the other side and check for any discharge, abnormal discharge, any redness, any bleeding. I didn't see any. So Your ears are good, intact, and clean. Then I will go to your nose. I will inspect and see if your nose in like is symmetric and the shape. There's no external like there's scars. There's nothing. And then, do you have any discharge, any nose, any pain in your nose? Nothing. So I will go inside to check if there is no runny nose, no abnormal discharge. The mucous membrane are very clear. Your nose is intact. There's no problem. So now I will go down to your throat, to your mouth. Okay. So can you open? I can let me inspect first. Okay. I will inspect and see. I look at the lips. Do you have any problem with eating?
No.
Do you have all your teeth?
Yes.
Okay. The lips are dry, are clear and pink color. Very nice. Now I'll ask you to open your mouth for me. And you say, I'm checking for the tonsil and uvula. They are in the midline. They are fine. And the tongue is clear too. So everything is fine. Now I'll go inspecting your neck. There's no abnormal sign from the exterior. So everything is symmetric. There's no dropping on this side. Your neck is straight. I was just going to check now. I will palpate to see if there's any lymph node. No. I didn't see any lymph node. No. No lymph node. Nothing. Okay. Your assessment look good. Everything is fine. There is no problem at this time. And I want to see you again for the next assessment, okay? If you needed one. Thank you.